of the advantage of our fellowship is flexibility, and we have a lot of diverse cases of epilepsy.
This is a clinical epilepsy fellowship with a heavy exposure to EEG. Ours is characterized by having a large number of experiences at different sites. We have 2 very large clinics where the fellows are exposed to patient care under the direction of epilepsy faculty.
Basically, the fellows will interact with the faculty every day. They will read the EEGs, have didactic sessions for at least 1 to 2 hours every day with the fellow.
This is adapted to trainees who are pediatric neurologists as well as to adult neurology, and the tracks are a bit different for those two.
In our education program, we incorporated a lot of conferences. We'll discuss, the patient's history, imaging studies, EEG findings in details. Then we'll come up with a consensus among faculties. Sometimes the faculties may not have complete agreement on each issue, but this is one of the learning opportunities for the fellows to see how their thought processes are.
We have a large number of clinical research opportunities with very advanced brain imaging, advanced signal processing with our MRI physicists and our engineers who work on these various projects. So we have research that the fellows can jump into based on their own preferences and interests.
Our fellowship is actually very family-friendly and fellow-friendly.
So our weeks are very set up to daytime hours with some fairly long days, but our fellows do not take night call and do not take weekend duties. Those times are reserved for people to do their own study or other activities that are important to the work-life balance. We certainly have plenty of resources here at the University of Minnesota. It's a medical school that's really focused on health and well-being of the trainees as well as the faculty and, of course, especially the patients. So we're looking for people who want something like that, where they're pretty concerned about the well-being of their patients, but also, take care of themselves.